This is the skills validation for ostomy care. Today we're going to be going over how to change the colostomy appliances. Before we begin, we want to do the first 5. So we'll wash our hands, identify our patient. Hi, my name is Samantha and I'm a student nurse at HAC. I'm going to be changing your colostomy appliances today. Can you please tell me your name and date of birth? Okay, do you have any allergies? Okay, so again, we're just going to be changing your colostomy appliances today. Have you been experiencing any pain? Okay, good. And I'll make sure that I'm maintaining privacy and patient safety throughout the procedure. We do want to don clean gloves for this procedure. It's also very important with a colostomy, especially a new one, that can be a very life-changing experience for the patient. So you want to check in with them to see how they're doing and see if they do change it, if they have someone else. Sometimes they might not even look at it if they don't completely accept that yet. So you do want to just be mindful of that throughout. You can talk to them and show them what you're doing if they do want to be involved in learning the care. So we will drain the bag first into our receptacle, just opening the bottom and letting that drain into our receptacle. Okay, and you dispose of that appropriately. And we can use a saline solution bottle and clean the inside of that out. Right, so we'll detach the wafer and the bag. With this, you just want to keep in mind to try to be gentle, and if you're having a hard time getting the wafer off, you can kind of press down on the skin a little bit to try to reduce the pain when getting this off. And we want to inspect the stoma when we do have those off. So we want that to be a beefy red color, so this does look pretty good. We're going to check for any edema, any bleeding, any drainage, and we want to assess the skin integrity of the surrounding area as well. So this all looks really good. We will clean that with just a gentle warm soap and water, cleaning the surrounding skin and cleaning over that. And you do want to make sure that it's completely dry when we apply our new appliances. And then when we're preparing our new wafer, we want to make sure that it's the appropriate size. We want that to be 1/8, the opening on that to be 1/8 inch bigger than the stoma, so that when it's functioning, it has some room to expand. We want to be mindful and not constrict that opening. So we have a device, we would measure that, and then we would use that device in the appropriate size to cut the appropriate sized hole in our wafer. And we're going to apply that onto the dry skin. And we'll apply our bag. All right, make sure that our patient is comfortable. Let them know we'll be back in to check on them. And of course, we would wash our hands when we're finished.